Hello there. For those who are new, my name is Amya Shetty and I am a member of the M.M.I.O, which is the Misunderstood Mental Illnesses Organization. This YouTube channel is dedicated to explaining certain misunderstood mental illnesses. In this episode, I will be talking about mental illnesses as a whole. I will be talking about mental illnesses in India, what mental illnesses are, what are the most common mental illnesses, the causes, and how we can help people with mental illnesses. In this episode, I will also be providing the information that I know and the information that I have collected from a professional psychologist named Shrradha Sidhwani. Mental illnesses in India. According to Harshita Rathore from the online magazine The Diplomat, 7.5% of India's population has a form of mental illness, whether they suffer from a major or minor one. Also, according to the same author, India neglects their mental health patients and barely spend any time or money on them. Because of this, mental health illnesses are shunned upon and ignored. What is a mental illness? A mental illness. It is not a physical illness, hence the name. A mental illness can cloud the judgment of the patient and make them think and act differently. Some mental illnesses hurt the patient so badly it can stop them from doing certain things in their day-to-day life. Mental illnesses can also make it hard for the patient to function normally. What are the most common mental illnesses? A few of the most common mental illnesses are anxiety, depression, PTSD, meaning post-traumatic stress disorder, and OCD, meaning obsessive compulsive disorder. When someone says common, they mean the mental illnesses that the majority of the world has. How do people get mental illnesses, meaning the causes, and so on? Mental illnesses can be caused by a number of reasons. Many believe that mental illnesses are genetic defects that could be passed down from generation to generation in families. But this is not always the way mental illnesses can be caused. Mental illnesses can also be caused through trauma or bad health. Stress can cause anxiety, and depression can also be caused by a lack of self-esteem. The passing of a loved one could cause a mental illness. Not being able to get good grades and catch up with schoolwork could also cause a mental illness. Living in a harmful environment could also cause a mental illness. There are many things that can cause a mental illness. There will never be one single reason for mental illnesses. How can we help people with mental illnesses? If we have a better understanding of mental illnesses and what goes on in a patient's mind, we will be able to help them. Many people who don't understand mental illnesses would not understand how sometimes a person cannot be around a large crowd, or sometimes they wouldn't understand how their friend would be scared or crouched down when there are fireworks or when they see a fast-moving car. Many people would think that it is weird when that happens. We can help them by understanding them and understanding what they go through. Of course, we can't mentally or physically think and act the way they do to understand them, but the least we can do is give them space or help others understand. Remember this as a warning though. I am not a licensed psychologist or professional. Please do not self-diagnose yourself or anyone else. If you feel like you have the symptoms listed in the future videos, please contact a professional at once. Once again, I am not a professional. I am just a student interested in spreading awareness and helping out. The next portion of this episode is dedicated to the interview that I conducted with Ms. Shrradha Sidhwani. In this interview, I will be asking her a range of questions, and her answers will be displayed soon. Before I present Ms. Sidhwani's answers to my questions, I'd like to introduce Ms. Sidhwani as she will be featured in my future videos as one of the guest speakers. Ms. Shrradha Sidhwani is a clinical psychologist based in Mumbai. She is also the founder of the Reality and You Foundation. In this segment, I will be asking the questions and I will also be reading out the answers that Ms. Sidhwani had given me. I have altered Miss Sidhwani's answers a little bit to make them a little easier to understand. Just a notice that I have Miss Sidhwani's consent to use the information. What are or is a mental illness? A mental illness will affect one's functionality in life. A mental illness is when one becomes dysfunctional in their daily functionality or daily habits. Because of this, one will become dysfunctional in their daily routine, which results in one tending to have disruptive relationships, and it would also disrupt the other parameters such as loss of sleep and appetite. What can cause or typically causes mental illnesses? There are four factors that can cause mental illnesses: genetic variance, environmental deprivation, biological factors, and neurological disorders. Genetic variance. So, one of the factors are genetic variance. You have a few disorders that we being a group of research psychologists, have seen run through a family. Disorders like depression and schizophrenia are highly genetic. We have done a lot of twin studies where we have seen that there are genetic variants factoring in. Mental or mood disorders are also psychotic disorders. We see a lot of genetic variants in there. Environmental deprivation. When we are talking about environmental deprivation, it could be a childhood trauma, abuse, deprivation in the childhood in terms of basic needs like emotional needs and psychological needs that have not been satisfied. Biological factors. The third factor would be biological. Biological factors could be problems with one's thyroid. We being a group of research psychologists, have seen often enough that in cases of thyroid, people do have mood swings. Or one can see that in a menstrual syndrome that women have. So, post pregnancy, people can have a postnatal depression. Prior to their menstrual cycle every day, they could have premenstrual syndrome. So, we see these hormones which are fluctuating, and this could lead to some form of mental illness. Neurological disorders. The fourth factor is any kind of neurological disorders. Neurological disorders could be any kind of dementia. There could also be any kind of trauma in the brain. It can be someone that has some form of brain injury, which could be a clot, cancer, or tumor in the brain, or any kind of degenerate disorders such as Alzheimer's. These can also lead to some part of depression and psychosis and other things like that. We've seen in cases of accidents where there's been injuries inflicted or any form of trauma to the brain, it could lead to a mental illness. How can one identify if someone has a mental illness? What are the traits of a person with a mental illness? Most commonly, any form of behavioral change would be portrayed as the person having a mental illness. For example, if a person who's very social all of a sudden becomes very introverted. So, if one can see a significant change in behavior. In children, this is also very common. We being a group of research psychologists, have seen that they do not tend to enjoy their day to day routine. They tend to get secluded. One of the most important identifying factors is any change in behavior, any change in sleep patterns and in appetite, and the person having negative thoughts. In terms of anxiety disorders, one can see that a person tends to avoid situations, and they will not be able to go back to their normal functionality like they were doing. If you look at the COVID situation, one can see that we have many people who are getting excessively high rates of anxiety. And some signs could be that the person gets very obsessive. In COVID, we've seen people worrying excessively about their health. For example, the person would think, oh, am I clean enough? Do I have to wash my hands or keep using sanitizer? Do I have to wash everything that comes into the house? So, any form of behavioral change which becomes extremely obsessive and disrupts a person's functionality. Sometimes the person may not realize that they have a disorder. There are certain disorders, such as personality disorders, where the person does not have the insight and they will not realize it, but the people surrounding them will realize and notice it. Their friends will notice the behavioral changes, such as sudden outbursts of anger, tantrums, aggression, crying outbursts, and so on. These are the certain ways one can determine or see that the person next to them is not coping well. Thank you, Miss Sidhwani, for helping me. These are Miss Sidhwani's socials. And this is Miss Sidhwani's website.